Welcome to the SNOMED CT Expo 2020. Today we're going to have a presentation from Suresh Kumar Sharma entitled A Cross-Sectional Survey of Clinical Terminology User Community in India. My name is Alison Deli and I'm with Communications at SNOMED International. So we are going to have the presentation from Suresh in a minute. While he's talking, please type your questions in the Q&A box and he will respond to them at the conclusion of the presentation. Suresh, please proceed.
Hello, Namaste. Greeting from NRC India. The title for today's presentation is A Cross-Sectional Survey of Clinical Terminology User Community in India. This cross-sectional survey discusses the result and observation of a survey conducted on SNOMED City users from different organizations across the country and professions involved in the clinical terminology integration, implementation, and usage in India. As we know, clinical terminology offers a standardized way to represent clinically relevant information unambiguously in an electronic health record. Clinical terminology standardization facilitates semantic interoperability between different systems to communicate and exchange relevant information. In order to plan and promote terminology standards effectively, it is important to understand who the users are for the SNOMED City implementation or integration. What are the use cases for integration and what issue is they face or faced? In this regard, there is a need of various cross-sectional surveys. What is the importance of that survey? These surveys are help us to get real feedback from implementers. It will also assess the level of knowledge available or required to understand real-time experiences, issues and challenges regarding SNOMED City implementation and adoption. Regarding electronic health record standards, Ministry of Health and Family Welfare, Government of India has taken many initiatives. Ministry of Health and Family Welfare, Government of India has notified the Electronic Health Record Standards for India in September 2013. These standards are revised EHR standards for India were notified in December 2016. In EHR standards notification December 2016, Ministry has recommended SNOMED City as a primary clinical terminology. Then, Ministry of Health has established a Center of Excellence named as National Resource Center for EHR Standards (NRCES) at CDEC Pune to accelerate and promote adoption of EHR standards in India. NRCES acts as National Release Center (NRC India). After that, Ministry of Health, Government of India released a blueprint in 2019 to create National Digital Health System, that is NDHM, to create trusted ecosystem of health repositories, health registries at national level, and application for effective, affordable, and timely universal health care with focus on privacy of health data. Glimpse of NRC's India services. SNOMED City service providers are 542 across the country. NRC has also successfully conducted workshops and training that are 142. Then national website for Smart City is 30. There are 1500 plus more than toolkit users, which toolkit provided by the NRC is India. There are 122 organizations has been connected by this, and 6,654 professional has been sensitized. India Dry Extension has been released by NRC India covering 6 national programs. After COVID-19 disease pandemic, NRC has been released a India COVID-19 extension for easy integration of Smart City. India Geographical Location Extension has been released by NRC India. India Patient Instruction Language Extension has been released by NRC India. These are the glimpse of services which has been provided by NRC India. The research study objective of this survey. Our objective were to assess the knowledge of Smart City clinical terminology among healthcare system implementers and users, to study and understand the extension of adoption and use of clinical terminology among the user community in India, to understand the gap, if any, in adoption, to assess the benefit of services provided by NRC India and Smart International across the country involved, to understand the motivation of integrating Smart City in EHR or EHR system. Material and research method adopted for this survey. Quantitative research approach has been adopted for this survey. A cross-sectional research design has been implemented. The research setting where survey has been conducted were 122 target organizations in India. A web-based sampling technique used to collect the survey. There are 25 item questionnaire with 3 sections, and target population who had covered were medical professionals, health IT professionals, nursing professionals, academicians, researchers and developers. Professionals involved in health informatics were selected in this survey. Data collection instrument, 25 item questionnaire with 3 sections has been integrated. Section 1, demographic profile covering age, gender, occupation, organization of types. Section 2 include multiple choice questions to access basic Smart City knowledge. Section 3 is given status of Smart City adoption. So there are this type of section we had divided for survey questionnaire. The questionnaire contained mandatory questions, optional questions, multiple choice questions, and free text responses. Web-based surveys were carried out by using Google Form. This Google Form link, survey link, has been shared with 122 organizations across the country through the email, social media, and during events conducted by NRCS India. The survey respondent says demographic characteristics of the respondent. Majorly, user community are from middle-aged managerial level who play a major role in decision taking and policy making. By the diagrams, you can understand that majority populations were from 31 to 40 years age group, that is 34.69%. Also, we can also focus that our younger generations may lead to a better adoption if they have been sensitized in the knowledge regarding Smart City. Participation of top management may need to be increased for adoption of Smart City and integration across the country in various healthcare applications. The gender distribution is analogous to the country-level workforce participation rates. Here, male and females are participated in equally for the adoption and knowledge in this survey. Composition of professionals in Smart City users. In this survey, we have covered more than all type of professionals that include researchers, managers, developers, engineers, students, healthcare professionals, and other all professionals. The majorly participants are healthcare professionals. As we know, healthcare professionals are influential to adopt the Smart City and are driving force the adoption of Smart City in India. Non-availability of health data and related tools for research may affect in building students and researcher based. As students are researcher very less, you can see the bar diagram. Availability of better use cases on Smart City uses and analytics would be helpful to take adoption at the next level of Smart City. Direct engagement at colleges, organizing various hackathons, promotion of AI, artificial intelligence, and analytics may help in the engagement of Smart City in the healthcare applications. Data insights, whatever the survey has been collected, what this is, data analysis and interpretation has been divided in 5 sections. Section first is related to knowledge of Smart City clinical terminology among the users. Second deal with study and understand the extent of adoption and use of clinical terminology. Section third, to use the issue and challenges or to understand the gaps, if any, in adoptions. To assess the benefit of services provided by NRCES and Smart International. And last section, to understand the motivation of integrating Smart City. Now we will see results of this section. First, you can see impact of training and education regarding Smart City on knowledge level of users. Training and education program play a vital role to enhance the knowledge regarding Smart City among the users. In this regards, NRCS India has provided various types of services to adoption of Smart City in India or in any healthcare applications. For that, NRC's website contains webinars, workshops, talks and conferences have generated significant interest among the users of Smart City in India. The majorly 59.18% of all respondents indicate they attended training. Out of them, surprisingly, you can see 84.48% out of those were exclusively trained by or through the NRCS India. In this lesson, NRC guided and customized training program play a pivotal role in spreading knowledge about Smart City. Here diagram or bar diagram is showing the same. Knowledge level changed due to training and education. There is a significant changes in the level of knowledge regarding Smart City clinical terminology among users and implementers. By the bar diagrams, you can see 82.65% users have good knowledge regarding Smart City clinical terminology. Implementation of Smart City terminology require a clinical as well as the technical knowledge and experience for the implementation in the healthcare application. This survey study established that training and education program run by the key agencies kick-started the adoption of Smart City in India. These changes are due to professional sensitization regarding uses and benefit of Smart City integration in healthcare applications. Through the training and education programs. Smart City implementation status has been reported in survey in various healthcare applications. The bar diagrams is showing majority of the users have implemented or planning and are in process of implementation in their healthcare applications. Whatever Smart City knowledge they had gained, they had integrated Smart City in their applications majority. Experience of user community in adoption of Smart City. Here you can see majorly 61.29% users are having experience with Smart City is 1 to 3 years. The experience and uses has gained momentum after notification of use of Smart City in India by the Health Ministry. The policy decision influence adoption of standards of Smart City. These users on board on Smart City increase after establishment of NRC in India. NRC play a pivotal role in promotion, adoption, and usage of Smart City clinical terminology in the healthcare applications. In the survey, we had asked what type of Smart City integration tool has been used by the users. Here you can see there are free and open source tools are available. That is 45.16%. The availability of these open source tool has been provided by NRCS India. Open source tool or SDKs developed within India are the most used by the population under study. Availability of free and open source tool for integrating standards play a vital role in the decision to adopt the standards. Then, the tooling support provided by the NRC India is provided for the standards integration as per implementers' need remains a priority for the NRCS. Here also you can see a pie diagram where mostly used Smart City integration tool is SysNodeDK, which is developed by the NRCS and free and open use in India. Then there are equal percentage are for own developed APIs also has been used for Smart City integration, and some users has been used Smart International Browser for Smart City integration. Interoperability status of Smart City adopted applications. Majority 71.42% users are exchanging data and under plan for exchanging data. So most of the users have interoperability in their healthcare applications. Demonstration of interoperability and its benefit through the use cases may influence the building more interoperable healthcare systems. Survey also highlights that promotion and adoption of data structure and exchange standards is needed for interoperability in any healthcare application. In survey, we are very curious to ask what are the factors that prompt the vendors for integrating Smart City in EHR or EMR system. Survey shows majority 71.43% are integrated Smart City for interoperability purpose. And other factors are also for integration of Smart City, that are data reporting, to remove the need of master tables for the development, for better use interface, for medical treatment plans. These are the other reasons that prompt the vendors for integrating Smart City in healthcare applications. In this survey, we also asked the free text questionnaire regarding challenges faced in the adoption. There are many points we got. Out of that, the most important key points we had highlighted here. The key observation from the free text questionnaire on challenge faced in adoption of smart city, there hospitals personnel are not very aware about smart city and its uses. There is a disapprobation of the data entry by the clinicians. Lack of mandatory guidelines by the authority to integrate the smart city, because smart city has been recommended to integrate in smart city, it is not a mandate. Here also we got the key remarks regarding smart city. There is a no better encoding system for clinically relevant observation than smart city. This we have received from the users. Then the purpose of using smart city in healthcare applications. Any healthcare application in which smart city is used illustrates that EMR, EHR or PHR and practice management are the majority where smart city has been integrated. Other than, there are clinical decision support system, data analytics, health information exchange, and diagnostic services are the second top use cases for integration of smart city in healthcare applications. Then for claim processing, ICD-10 is mostly used in India in any healthcare application. So these are the purpose of integrating smart city in healthcare application. Then discussion of survey findings. The study established that training and education program run by NRCES kick-started the adoption of smart city in India. Survey also highlights that before notification of clinical terminology, the usage was almost none. Then NRC India guided and customized training play a pivotal role in spreading knowledge about smart city. Tooling support should be one of the priority of NRCs for ease of implementation across the country. The focus on wider user of the community included researcher and student is needed to integrate the smart city and to increase the knowledge at that level. The study explored that challenges of onboarding the users to the system and lack of mandatory guidelines affect the adoption of smart city in the country. Then conclusion of this survey. The survey provides much needed timely information for informed decision regarding the use and adoption of smart city. Participants under the survey study are having good knowledge regarding smart city implementation. There is a greater need to create more awareness in the country so more implementation can be achieved through this training and customized training programs. Then there is a recommendation for that similar surveys should be conducted periodically so that changes in the user's express attitude can be tracked and help direct development goals, and it will ease the adoption of smart city across the country. Thank you from NRC India.
Thank you, Suresh. We will now transition to the live Q&A to allow you to respond to people's questions. Thank you.
All right. It looks like we have some technical difficulty with the sound at the moment. For those who submitted the question, we will get back to you via the message on the Expo platform. Thank you very much. This will conclude our session today, and we wish you a great experience for the rest of the Expo. Thank you. Goodbye.